I am a care of the elderly physician, and what we've done in the last 2 years is we've placed physicians like myself in the 5 home care networks in the Edmonton zone. I get to provide home-based assessments for seniors in their homes as well as in lodges like this. So that's what brings me to Clover Bar Lodge. One of the things family caregivers, and this is evidence-based, need is recognition. They need to be recognized and they need to be acknowledged. Now that's a first step. But what's more important, the recognition actually leads to discussions around care planning and delivery. This is the opportunity that once we recognize family caregivers, that we can actually engage them, particularly in the healthcare system, without having identified who they are and the role they play, the contributions they make. Often we miss this opportunity to create that collaborative working relationship. For the last many years, we've been exploring how can healthcare system and healthcare providers support family caregivers? How can they become a part of the larger system that supports family caregivers, not just to sustain care, but also to support their health and well-being? And what we landed on 2 years ago was the training that's required to educate healthcare providers to support family caregivers. And we developed a competency-based framework. And then we went about co-designing the education that we believe is required for healthcare providers to support family caregivers. And this education, we call it caregiver-centered care education now, is online. It's the foundational education. It's designed for all disciplines in healthcare in all settings. It's on a website called caregivercare.ca. It's free. It's been evaluated and it's been rated very highly. So now we are using this initiative to inform the healthcare providers as to how they can engage family caregivers in care planning and delivery, and truly consider them care partners, consider them as part of the team. Family caregivers really are the shadow workforce in our society. They are the backbone of our healthcare system. And we need to come together and we need to collaborate and coordinate the supports we provide this shadow workforce, this backbone of our healthcare system. So my plea to everyone who touches or interacts with family caregiver first is to acknowledge them, recognize them, appreciate them, and then look to see how you can support them.